I'm Christen Provo, one of 5 registered veterinary technicians at the Kansas City Zoo. Let's go take a look at the Veterinary Health Center. First up, we have our office area. Seems boring, but actually very important. We enter lots of records so that we can stay up to date with what's going on with our animals, and all of our veterinarians can keep track of it as well. But let's go see the fun part, which is the lab. All right, so this is our lab at the Veterinary Health Center, and this is where the veterinary technicians can evaluate all of the samples that are collected from animals. And between us and the veterinarians and the animal care specialists, we collect a lot of samples from our animals. We work a lot as veterinary technicians with our animal care specialists to train animals to behaviorally participate in their health care. So we can collect samples from them like blood, and we can evaluate it in our lab. Here we see some avian red blood cells, which means bird. This is actually from one of our Humboldt penguins. So they look very different from mammalian samples. And as veterinary technicians in a zoo setting, it's our job to get familiar with different kinds of species that are not just mammals. We also in our lab get to evaluate a lot of urine and feces, which is super fun. There are a lot of lab nerds around here, so it is actually fun for us. But it gives us an opportunity to get a better picture of what's going on with our animals right away in-house, and we can communicate to the veterinarians if there's a concern or an issue, and we can address it right away. Now that you've seen our lab, let's head over to Radiology with Sydney.
Hi, I'm Sydney. I'm one of the registered veterinary technicians here at Veterinary Health. We are in our radiology room, which is where we capture all the radiographs of all of our patients anytime they're anesthetized. We're able to take a radiograph, which is actually the image we get by shooting the X-ray beam through the animal, so we're able to see the internal structures. Up on the screen is one of our images. It's actually one of our dictics, and it's one of my favorites because you can see a calf in her belly. She's not currently pregnant, it's an old radiograph. We're able to go out in the zoo with this portable unit, so we take radiographs out in the zoo as well. And as a registered veterinary technician, part of our job is to take the radiograph as well as adjust the technique and position animals to get the best image. After our animals are done here getting radiographs taken, they often go over to our surgery suite for their exam. So let's head over there and check it out.
Hello, my name's Corryn. I am the Senior Veterinary Technician here at the Kansas City Zoo and Aquarium, and I'm going to show you our surgery suite at Veterinary Health. So we do a lot of routine procedures for our animals. We are all about preventative medicine here, and we anesthetize our large carnivores and our primates alternating years just to do routine health checks, make sure everybody's safe, healthy, parasite-free, and as happy as we can make them. Every immobilization consists of a full dental cleaning. We take various samples, blood, feces, urine, just to test and make sure all their parameters are normal. If they are ill, they also come here and we can do full surgery if needed, depending on the situation. This is our surgery table. You can see it is currently outfitted for a procedure. We are having an immobilization procedure today. We have anesthesia machines. This helps keep them nice and asleep and well oxygenated while they're under anesthesia. We also utilize this diagnostic tool. This is called a thermography camera. And what this does is it takes heat signature images of animals, so we can use this to see what their internal temperature looks like across the body. This also helps us find various potentially non-visible injuries. So if they have been hurt and have an abrasion or they're limping and we can't really see a wound, this can help us find inflammation under the skin. Other tools we utilize, you will see above me are various forms of what one would assume would be potentially garbage. This is actually our anesthesia mask selection. So as you know, our animals are not normal cat dog size, so we have to improvise to make anesthesia masks to cover their faces correctly. Some of my favorites are this old water jug that we have modified with some padding and tape. This is what we use for our larger great apes, like our orangutans, our male gorillas. their faces are too large and too wide for our standard anesthesia masks. So this just goes over their face like this, and then they can breathe and get a good seal and get nice anesthesia that way. And then I should have brought this closer. This one is also very fun. This is our sea lion mask. So sea lions are basically cone-shaped. So we can put their heads in here, put the oxygen tube in here with the anesthetic medication, and then this forms a nice tight seal around their little cone-shaped heads. All right, now that you've seen our surgery room, let's head over to the pharmacy to see how our animals' medications are dispensed.
Hey guys, I'm Randy. I'm a registered veterinary technician here at the Kansas City Zoo. I'm going to show you the pharmacy. The way this is set up is basically, we have gastric, hormone, cardiac drugs, and all of our antibiotics, vitamins, preventatives like heartworm and flea preventatives. As far as what we technicians do in here, basically comes down to what medications do we need to dispense that day, maybe what's coming up later in the month or week that we have to get ready. A lot of the times our animal care teams will fill out this little form kind of telling us what animals they have and what medications they're on, how much they want, and these are more like long-term medications, so we know exactly what we're giving them. Sometimes the doctors will come to us and ask, can we get so-and-so some meloxicam? We need it at a dose of 0.2 mg per kg. So we have to go and do those calculations. A lot of the times we have to be a little bit more creative on how we do things, just because a lot of these animals were not hands-on, not like a dog or a cat. So sometimes we have to go through and say like, oh, this particular animal really likes strawberries. That's something that they eat on the regular in their regular diet, so make their medications taste like strawberries. Now that you've seen every room in this building, I'm going to kick it over to Marissa. She's at the aquarium where we have a brand new veterinary suite.
Hi, my name is Marissa Medley, and I am a registered veterinary technician here at the Kansas City Zoo and Aquarium. We are here in our veterinary suite at the Sobella Ocean Aquarium. Very fortunate to have it. It's already been used for many different types of procedures. Over here we have our radiology station. This is a lead shield that we put that in between us and the radiographs to protect ourselves. This tablet is our new digital radiology tablet. It's wonderful because it's waterproof, it's very portable. We can take it all around the aquarium in kind of smaller spaces, up and down stairs, and we're not lugging a bunch of heavy equipment. So this has been amazing. The plate that the animal sits on is waterproof. So just lots of different things to think about in aquatic medicine that you might not have to with some mammals and birds and stuff like that. This section, more storage, but also ultrasound. Might not be commonly known that we can ultrasound fish. We can ultrasound almost any animal here at the aquarium. We have done that already. Anything from maybe a tiny little fish up to our sea otters. Over here, more storage, but I did want to point out our fish kits, as we call them. We put these together with some emergency medications, but also just some basic things like blood tubes, syringes, and so we do take those out into the aquarium for a lot of routine exams and stuff like that. Moving on to our computers, we can use these to check ZIMs, where all of our animal information is stored. So it's nice we can just come over and look up their accession number or age, weight, etc. We also can pull up radiographs on these computers, so we can pull them up on the screen here and look at things more closely, adjust parameters, add markings, things like that. So it's really nice. So this is a tour of our vet suite here at Sobella Ocean Aquarium. I hope that you get a chance to come learn about and see all of our new aquatic friends.
Thank you so much for taking a tour of the Veterinary Health Center with us at the Kansas City Zoo and Aquarium. Happy Vet Tech Week to all of our colleagues across the country.